Yeah, so that's this. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today, we are correcting writing letters for nurses and doctors. So this is the letter of the afternoon, or we can say evening now, 4 p.m. So Dr. Naufa Hameed. Right. This is a letter, doctor or nurse. Okay. Psychiatry related. So first one, doctor, medical writing task 1. Dr. Decompensated. Very excellent handwriting, Naufa Hameed. The previous letter I did not want to correct, but this letter I love to correct. Very excellent handwriting. You are a very obedient student. Maybe you are a doctor, but not for me. Okay, for me, you are a child. You are a student. Okay, so you can think that the difference. You made me happy by presenting this handwriting. Dr. Decompensated, very good. Proudest family practice. Okay. So primary care physician. Why did you not write this one? Okay, 231 Brightfield Avenue. Proudest. So physician. Okay. Proudest family practice. Okay, primary care physician. You could have written the patient's primary care physician. Okay. So doctor, that's enough. No problem. Doctor is enough. Physician. Right. That's good. No problem. 10 March 2018, dear Dr. Giovanni Decompensated, regarding Mr. Bethany Tailor, a 35-year-old female. Now, here Miss is there. Miss means female only. How can you write female? The word female. Female means a cat, a dog, a horse, a donkey, an elephant, everything may be female. Female what? Okay, better don't write the word female or male. Don't write like that. It is a gender-based discrimination. So you should not use this word female. Okay, with this you can write female patient, you can say. But no need, because Miss means female only. Miss means female only. So why do you want to write female? Don't write. Don't write. And a 35-year-old, then if you write year-old, 35-year-old, you have to put hyphen. 35-year-old, like this, 2 hyphens you have to put. Then a 35-year-old woman, but woman also is not needed. Female, no need. Why do you want to write all these things? Better avoid, na? Better avoid, na? Why do you want to write so much? Okay. So what you can write is, what is better? Okay. Bethany Tailor, 35-year-old. Okay. Date of birth is not given. So what you can just write is aged 35. Just simply aged 35. That's enough. No need to write too much. That's enough. Because female is here already, Miss. Miss means female. You cannot say male. So Miss Bethany Tailor, aged 35. Years, 35 means years only. We can understand. A is not needed. 35 is not needed. 35 means age only. So old is not needed. Female is not needed because Miss is already there. So Miss Bethany Tailor, aged 35. That's all. Simple. Keep it simple. So this much lengthy. Why? Are you doing something great thing here? Nothing. Okay. Doctor's time is very precious. So be limited and precise, which is important, right? Unnecessary. Okay. So when you say Miss means female only, so why you are writing female? 35 means age only. Why are you writing? Years only. Why? Okay, so no need. So Miss Bethany Tailor, age 35, finished. Thanks for seeing Miss Tailor, who was diagnosed with schizophrenia. Schizophrenia, SCHIZOPHRENA, schizophrenia. She has been discharged to you for the appropriate primary care. Okay, right. She has been discharged to you. She has been discharged. She is not discharged. She is not discharged. You are writing, at the time of writing, she has not been discharged. She is being discharged. Okay, not finished. She is being discharged. Action in progress. So you cannot say she has been discharged to you. Why do you want to write to you? Why do you want to write to you? No need. That's why you are writing to him, na Giovanni Di Coxio. Writing to him because discharging to him. So why do you want to say to you? Okay, if you are sending to him, why do you want to write to you? No need. Otherwise, why will you send him the name here? Okay, for appropriate primary care. No need the. Okay. Thanks for seeing Miss Tailor, who was diagnosed with schizophrenia. Okay. She has been discharged for appropriate primary care. She has been discharged for appropriate primary care. Try to understand that one there. Right. The next one. So what type of letter is this? Discharge letter or referral letter? Okay, check it out. How do you check it out? Go there. Here you will know. Write a discharge letter. So that's it. Okay, he is being discharged. Okay, thanks for seeing Miss Tailor, who was diagnosed with schizophrenia. She has been discharged for appropriate primary care. So instead of all these things, thank you for seeing. Why do you want to write thanks for seeing? No need, no? I thank you for seeing Miss Tailor. Why I? It is understood. I thank you for seeing. Thanks for seeing. Whom I am thanking you for seeing. That is the meaning, understood. So why do you want to bring this full story here? Why do you want to give yourself importance? Why do you want to give him importance? Miss Tailor is more important. So why don't you start from here? Miss Tailor, who was diagnosed with schizophrenia, is being discharged. Is being discharged for appropriate primary care. Like that you can say. Is being discharged. Okay. Today, for appropriate care at your facility. Is being discharged today. 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 Like that you can write now. For appropriate primary care. Okay. Now let us see there. Okay. So letter to the patient's primary care physician. So he is only primary care physician. So why are you writing primary care? For what is the purpose you are writing? Discharge back to apartment. Is not discharged to the primary care. Discharge to, okay, discharge back to apartment with follow-up at Raudas Mental Clinic. So requires follow-up. Discharge back home today. Okay, is being discharged back home today. Discharged back home today. Miss Tailor, who was diagnosed with schizophrenia, is being discharged back home today. Okay, right. Right. Okay, then you can say she requires, okay. So follow up at Progress Mental Clinic at your facility. Okay. Follow up. Okay. Right. So discharge plan. So she requires follow up, only follow up. Okay. She requires follow up at your facility. Okay. At your facility. Okay. That's Progress Mental Health Clinic. So there she has to go for follow up. Right. So this is the way you can write. Right, next one. Miss Tailor felt agitation and aggression in her behavior. Antipsychotic. What's the spelling of psycho? Antipsychotic. Where did you check that one? Okay. Where did you check that one? Antipsychotic. Antipsychotic. Here it is. What is the spelling? Can't you see and write? See? Antipsychotic spelling. CH. You think I'll spare you for this? You write 5 times or 10 times this word. Because you are a doctor and you are not supposed to do mistakes. Okay. Even a nurse is not supposed to do mistakes. Okay. Let me talk to, okay, Naufa. Hello, Naufa.
Hello, sir.
Are you okay with me? I'm hitting you black and blue. Is that okay?
Okay, sir, no problem.
And then afterwards you should not cry, okay? Okay, not get angry with me. Okay.
No, sir. No, sir.
Like a small school girl only I'm treating you, okay? Because you are very
Okay,
obedient, I'm able to give all these things. Okay, you can mute back. I got your permission. Okay, now I'll roast you. So you have to be very careful. Miss Tailor felt agitation and aggression in her behavior. Her behavior, not somebody else's behavior. Why her? She cannot feel agitation in somebody else's behavior. Okay. So in behavior only. Antipsychotic medication had started. What? Had been started. Had been started. It's not had started. It had been started. Okay. It had been started or was started. Antipsychotic medication was commenced for the symptoms. Okay, for the symptoms. Was commenced. Started. Started is not a good word. Commenced, you can say, no, it's better word. Okay. Was commenced. Was commenced. Enough. Was commenced for the symptoms or for treating this problem? No need. Was commenced. Miss felt agitation and aggression in her behavior and therefore antipsychotic medication was commenced. Okay. Or for which antipsychotic medication was commenced. Or full stop, antipsychotic medication. Therefore, antipsychotic medication was commenced. Are you not making note? So you can write therefore here. Therefore, or so, therefore, comma, antipsychotic medication was commenced. On March, why O is small here? O should be capital letter, no, starting. And March, capital letter, no? So you have two problems here. Number 1, sentence begins with a capital letter. Sentence begins with a capital letter. You have to. I need not tell that one to you. You know it better. Number 2, names of months. Names of the months. First letter capital. Names of months. First letter capital. So this should be on March 10. On March 10. Why do you want to write on March 10? On 10th March. On 10 March. You can write no date first always. Why do you want to write date next? Normally date comes before the month. No? Then why are you writing month before? Date on March 10, comma. Rule is a rule. You cannot break the rule always. In speaking, okay. Patient reported. Why are you using the word patient? Why are you using the word patient? Do you think it is fine, a good word to use? Can you tell the patient, hey patient, come here, he'll get angry. If I tell a patient, hey patient, come here, means he will slap me. Okay, he'll be wild and angry. Nobody wants to be called a patient or labeled a patient. Okay, so don't use the word patient. Because this letter will go into his hand, maybe he will read it. He'll get offended. So on 10 March, they reported there was no auditory or visual hallucinations. Okay. Reported that there were no. Reported that, even first let me correct this one. Reported that there were no. There were no. There were no auditory or visual hallucinations. Say plural, yes. So were. There were no. If it is singular, you have to use was. Okay. Okay. So on 10 March, patient reported that there were no auditory or visual hallucinations. Okay. So you can change it like this. On 10 March, okay, on 10 March, absence of auditory and visual hallucinations was reported. Passive voice. Write down like that. On 10 March, okay. What is this? Why this corner you have to write that corner only? Why did you write in this corner? And full page you have to print a photocopy. Why only this small? Where I will write now? If full page is there, I can write. Oh my God. Full page you have to take photo, not only picture of that particular area. Now where I will write? Okay. On 10 March, comma, absence of auditory and visual hallucinations. Okay. Was reported or mentioned. So like that you can write. On 10 March, absence of auditory and visual hallucinations, absence was reported. Okay. Delusions were minimized, not was. Oh, yo. Handwriting improved. Now grammar, correction grammar. Very good. You are very obedient. That's why I'm explaining all these things. Delusions were minimized. And able to focus the day-to-day activities. And ability to focus. Delusions were minimized. Okay. Minimized delusions and ability to focus. Minimized delusions were minimized and ability to focus on the on the activities of daily living. Okay, ability to perform the activities. Delusions were minimized. Okay, so you can write, see, if you leave the space, no, I can write something. You did not leave the space only. Okay, minimized. Okay, reduction. Okay, reduced delusions. Delusions were minimized. That's finished. The next one. Where's the next one there? Ability to focus on day-to-day activities. Okay. Ability to perform the activities of daily. Ability to perform the activities of daily living. Ability has been notified. Ability to perform the activities of daily living has been notified. Okay, or was notified. Past tense means was notified. Present perfect means has been notified. On 10 March date. So past date. So past tense you have to write, not present tense. Okay, like that you have to change. Hallucinations, very good, excellent. Now your handwriting is very clear. Ability to focus on, okay. Then she was assessed by nurses for significant signs of psychosis and also ensured that she is compliant with medication. She is compliant with medication. Okay. Medication compliance was ensured. Medication compliance was ensured. And significant signs of psychosis were assessed. Why she was assessed? Why she? She is not important. Okay. Significant signs of psychosis and significant signs of psychosis was assessed. Like that you can write. Okay. Significant signs of psychosis were assessed. Okay, or she was assessed for significant signs of psychosis. Okay, significant signs of psychosis were assessed. Significant signs of psychosis were assessed by the nurses. Why do you want to write the by the nurses? Then you think teachers will go and do that, or lawyers will go do that? No, no. Nurses only will do. So why should you tell about that? Significant signs of psychosis were assessed, and medication compliance. Medication compliance and medication compliance what to do? Take full page picture next time. Significant signs of psychosis were assessed and medication compliance was noticed or observed. Significant signs of psychosis were assessed and medication compliance was noticed. Like that you have to write. This is fine. This sentence is also correct, but this is active voice, low quality. Then she was assessed by nurses for significant signs of psychosis and also ensured that she, see again, she, too many times, is compliant with medication. Medication compliance, okay, was ensured and significant signs of psychosis were assessed. These are important words. Now see, I'm showing you the important words, okay? So now here, medication compliance was ensured and, okay, significant signs of psychosis were assessed. That's all. So significant signs of psychosis were assessed and medication compliance was noticed. Finished. That's all. Nurse help to control the behavior. Why nurse help to control the behavior? Behavior was controlled. The behavior was controlled. Why nurse? Why doctor? The patient shows. Why patient? Too much of patient, nurse, doctor. Okay. No need. Nurse is not important. Doctor is not important. Patients is not important. Okay. Even patient is not important. Shows good progression. Excellent progression has been noticed. Okay. Observed. Okay. Excellent progression or excellent prognosis has been observed. Prognosis. Now, what is this word prognosis? Okay, prognosis is a special word. A doctor's judgment of the likely or expected development of these or of the changes of getting better. That is called prognosis. Okay. Okay, prognosis means improvement, excellent development, expected development. Excellent development. You can see here, right? So you are a doctor, so your quality should improve. Excellent prognosis has been noticed or observed, or excellent progression, okay, of our health condition has been observed, like that you can say. Okay, the sentence is correct, no doubt the sentence is correct, but active voice. Okay, the patient is not good. Active voice. Illness get worsened. Illness gets worsened. Why gets worsened? Illness worsens if not taking medication. Okay. Illness worsens if medication non-compliant. Okay. Why do you want to write that one? Why do you want to write that one? That is normal, no? You need not write this one. There is no need. Okay, no need of this one. So, your guess you don't write. What is truth you write? Okay. The advices on discharge was prescribed. The advices on discharge was prescribed. Discharge education was provided. The discharge education was provided, not prescribed. Advices. There is no word called advices. Advice, uncountable. Advice is uncountable. Okay. Advice is uncountable. Okay. Discharge education was provided. Discharge education has been provided. Okay, fine. Discharge education was provided. Okay. Risperidone 4 grams nightly by mouth. Okay. And 1 milligram twice daily for agitation. So, has been prescribed. Okay. Risperidone 4 gram nightly by mouth and 1 milligram. So, start with risperidone. Start with risperidone. Risperidone. From here you start. Remove this all. Remove this all. Discharge education has been provided. Discharge education has been provided. Risperidone. Okay. No need till here. Risperidone 4 grams every night by mouth. By mouth every night. Orally every night. And 1 milligram twice daily for agitation has been prescribed. In terms of medical history, why H capital letter? In the middle of the sentence, will you put H capital letter here? Is it right? In terms of medical history, she is hypertensive and having hyperthyroidism. Hypothyroidism. Where is Y? Where is Y? Huh? Hypertension. Okay, she is hypertensive and having hyperthyroidism, being treated with Levothy, 88 mcg daily. Okay. In terms of medical history, why 5 words simply? This is medical history only, no? Understood. It can be understood. She is hypertensive and hypothyroidism. Okay, so you can separate these two sentences. She is hypertensive. Full stop. Hypothyroidism. Why? Hypothyroidism has been treated. Has been treated by the Levothy. Okay. She has been presented with the complaints of auditory visual hallucinations and delusions. This you should have written in the beginning, no? She should have written in the beginning, not here. Miss Tailor needs the primary care. Needs the primary care for schizophrenia. For any queries, please do not hesitate to contact me. Yours sincerely. Word count is very less. Okay, it's something like 160 or 170 words. Okay, your word count starts from here. 1, 2, 3, 4, 5, 6, 7, 8. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. 3 lines, 21. So 20, you take 3 lines, 20. So 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. 22 means 22 by 3 is equal to 7. Okay. So 22 by 3 is equal to 7. So 7 into 3, 21 lines you have written. 21 lines. Okay. So 20 into 7 is equal to 140. So every 3 lines, 21 words. Okay. So 3 into 7 is equal to 21. So 140 plus 10, 150. Maximum 160 words are there in this. Okay, maximum. Only 160 words are there. So you have to write a little more. Okay. It's not she has been presented, she was presented. Sometime back, no? Now discharge also being done. So how can you say she has been presented? She was presented. Finished, past tense. She was presented. With the complaints of auditory and visual hallucinations. Auditory and visual hallucinations and delusions. Okay. So Dr. Naufa, is that clear for you?
Yes, sir.
You understood? Now your handwriting is improved. Now your sentence quality should improve. Okay.
Okay, sir.
You are very good. You improved. One time I told you improved your handwriting. That's more than enough. Okay. Gradually you'll improve now. Okay.
Okay.
Don't you see a lot of changes there? Don't you see a lot of changes there?
What changes in the letter you asked me, sir?
No, handwriting, presentation,
Yes,
neatness,
sir.
clarity. I'm
Yes,
not
sir.
talking about English. I'm talking about presentation, correct?
Yes, sir.
Okay, so follow it the same. And today night I will correct another letter for you. And in the evening I will take one speaking for you. And reading and listening, I will correct. You just send them to me. I'll correct and I'll give you. Okay?
Okay, sir.
Okay, dear. Take care. Bye-bye. Any feedback from you? Do you want to say anything?
Yeah, sir. Day by day, I'm getting improved with all the 4 skills. I'm happy about that.
Yeah, you see, one reading I gave you, one listening I gave you, no? I gave you feedback for one listening. I gave you feedback for one reading. Now I gave writing. Then I'll give you for speaking. Okay, today evening I'll take speaking for you. Okay?
Okay, sir.
Okay, dear.
Thank you.
Okay, okay. So next is Cecilia Agbonten. Hello, Cecilia.
Hello, sir.
Hello, how are you?
Fine, thank you, sir.
Okay. So next we'll correct your letter, okay?
Yes, sir.
Okay. So Cecilia Agbonten. So your letter now. Type the name of the letter. Which letter I have to correct for you, Cecilia? Name of the patient. One name you tell me, that's all. Yeah. Ronald Scott, Cecilia. Cecilia Ronald Scott. Yeah, here it is. $23. Very nice handwriting, Celia. Very nice handwriting. Excellent handwriting.